because we're actually looking at a population that isn't dying off that quickly, particularly, but who are facing years of morbidity and healthcare demands. So they turn to Pop Data BC to access the adjusted clinical group system of Johns Hopkins University. I've actually met with that group. And then the part that hasn't been done yet is looking at morbidity longitudinally. So we're currently looking at how we can use our data in a longitudinal way to look at time-dependent risks of morbidity. And this is to further inform guidelines to care, because if for some subgroups they may have an excess risk of, say, cardiac problems at 10 years post-diagnosis, but that risk disappears by 20 years diagnosis. We want to know about that because we don't want to be testing people for a risk they no longer have. So that's one area where we're exploring more in depth.
Thank you.
Other questions? Okay. Well, I would like to thank you, Mary, once again for coming. And we're hoping that we can share your presentation. We do have recordings, and so far as just checking your slides and things, that would be wonderful if we can share with the audience your research. I know that you've mentioned that it's been a large scope of work, so it would be wonderful for other people to learn from that.
Thank you very much. Thank you.
Thanks again. And just a reminder, everyone, that there will be another Coast to Coast presentation in 2 weeks, so please stay tuned. If you've registered through Pop Data, we will be sending you reminders. And as always, if you have questions, please feel free to forward them to us. I'm sure